Hello and welcome to Herbalist and Herbs. My name is Chrissakis. Today's video is short, comprehensive cardiovascular profiling. Now, cardiovascular disease is still our #1 killer. It kills about 650,000 Americans a year, and about half of them are women. So the idea that women are not as prone to heart disease is simply not true. The general testing procedures in terms of prevention consist of a CBC, a metabolic, and a lipid panel, and those are blood tests that you're given. Now, if you, on that test, the doc sees that you've got even slightly elevated cholesterol and or LDL, the thing that they will prescribe is a statin. Now, statins do lower cholesterol and LDL, but they do a lot of other downside things as well. And one of the big downside things that statins do is they interrupt the process of the formation of coenzyme Q10. Now, coenzyme Q10 is intrinsic to muscle functioning properly. Your muscles need coenzyme Q10. The heart is a muscle. So when you're giving people a drug to save them from cardiovascular disease or help to prevent it, which at the same time in the long term will weaken the heart, just due to draining the coenzyme Q10 out of it or stopping it from being formed, then is a bit of a contradiction in terms of side effect. Statins are also hard on the kidneys. So again, the idea of the use of statins, when they began, the docs would prescribe 10 or 15 milligram dosages. Now it is not uncommon to see people on 50 or 60 milligrams, and forever. A pharmaceutical goal is to get 100 million Americans on statins. So, the idea of putting people on statins with a relatively small amount of information like elevated cholesterol and or LDL really doesn't fit well into trying to turn things around and re-strengthen the body. First of all, basing things on the cholesterol theory, there's not a whole lot of things to prove that cholesterol is a major factor in producing heart disease. Triglycerides are much more deadly in terms of elevation, and so is LDL. But to get back to the idea of testing and looking at things and then treating things accordingly, if you see a problem with a blood test like a CBC, a metabolic, and a lipid panel, and there is elevated cholesterol and or LDL and or any other vascular markers, there should be further testing done to see if there really is a problem. Because one of the astounding facts about the 650,000 people who die each year in the US of heart disease is that half of them have a normal cholesterol reading. So once again, cholesterol as an independent risk factor doesn't carry much weight. You need to do much more minutiae work, break down things into more detail so that you can see where there is a problem and then go after that. But the first thing that should be done, if there's any elevation and any idea of worrying about things, even if there's high platelet numbers, further testing should be done. And the testing that should be done even along with the CBC initially. However, if you see these things come up, then you can add it on later. But I think it should be added in. And these are the things that should be looked at. Fibrinogen, C-reactive protein, homocysteine, insulin, and HbA1c. Those 5 add-ons to a CBC will give you a tremendous amount of information and window into the vascular system that you really need to look at to see, is this person getting in trouble, and from what direction, so I can treat them properly. And not band-aid them in any way, but actually get to the bottom of the problem and rebuild their vascular system if I need to. So to look at fibrin, to break these things down and look at them in a general way, what those 5 extra markers do is they tell you what the quality of the blood is and if there's inflammation in the bloodstream. And in both cases, you can alter those things both with plants or herbs and supplements and diet. You can have a huge impact on things. Now, if, again, those numbers come up skewed and things are looking a little bit shaky in that area, for more depth into the vascular system, that is to get more clear ratios and or numbers of things like apolipoprotein A, apolipoprotein B, lipoprotein A. These are all other major markers that indicate the quality of the things that are in the bloodstream, the quality of the fats and the quality of the protein binders that are to them, that can give you much more specificity and also can tell you just how deeply in trouble this person is. And those two types of tests are called a VAP test, that's VAP, or an NMR test. And they can give you a whole nother wealth of data relative to the vascular system, again, in conjunction with the things you've already tested for, which are basically a CBC, a metabolic and a lipid panel, which usually come together, and then the add-ons of fibrinogen, insulin, HbA1c, C-reactive protein, and homocysteine. If you put those things together, you will get a clearer picture of the vascular system and what to use to heal it. And statins are not the best answer because of the amount of drawbacks they have on us physiologically. We can do wonderful things with those three things that I mentioned, which is herbs, supplements, and diet. And we can try to get our body strong enough so that we don't have to go on statins. All right, if you want any more information about cardiovascular disease and or the other things that I treat, such as cancer and diabetes and weight difficulties, please go to my website, which is herbalistandherbs.com. Thanks for taking the time to watch this video.